Atrial fibrillation is the most common rhythm disturbance in the heart that exists in the world. In the United States alone, 2 to 3 million people are affected by atrial fibrillation. It consists of an irregular series of electrical impulses that are occurring in the upper chambers of the heart, and this often causes an irregularity to the patient's pulse.
The atrial fibrillation could be very asymptomatic, but when the symptoms do occur, people feel dizzy, lightheaded, some people feel palpitations. A lot of patients have lethargy, tiredness, shortness of breath.
Some people have trouble breathing when they're trying to exert themselves, and some people experience chest pain.
Well, atrial fibrillation is a problem of aging, so as we get older, the atrial fibrillation increases in incidence. However, there are certain medical conditions which predispose you to atrial fibrillation, including high blood pressure, coronary artery disease, bad lung problems, severe obesity with obstructive sleep apnea, valvular heart disease, congestive heart failure, and some other conditions. There are many different ways of treating atrial fibrillation, which includes treatment with medication. Some patients may need pacemaker, and of course some patients need ablation procedure, what we call AF ablation.
The treatment plan for each patient has to be individualized because different patients have different surrounding medical conditions that directly affect the treatment plan. Some patients will be treated with medications alone. Some patients will be treated with lifestyle changes. Many patients will be referred for surgical procedures such as catheter ablation of atrial fibrillation. Catheter ablation is a procedure where we bring patients to the electrophysiology laboratory. We use general sedation so that people are asleep and they don't feel any discomfort whatsoever during the procedure. We place some IVs in the large veins in the leg, usually in the groin region, and this allows us to advance long, thin tubes with electrodes on them called catheters. These catheters are placed in various places in the heart. This allows us to record with great accuracy the electrical activity of the heart at all times. Some of these catheters also have the ability to deliver electrical current to very precise spots in the heart, and this allows for creation of scar tissue through heating of the tissue. The idea behind catheter ablation is to isolate the areas of the heart that are causing the atrial fibrillation.
The biggest advantage of the ablation procedure is that first, it is the most effective way of treating atrial fibrillation. Medications are only 40 to 45% effective as compared to ablation, which in patients with paroxysmal AFib is about 75 to 80% effective. And the second biggest advantage, I think, of catheter ablation is that if it is successful, it obviates the need for taking medication, which is a major thing, especially on younger patients. It also offers the advantage that you can look for other arrhythmias in the same patient and hopefully treat them in the same setting if necessary. I think the ideal patients, ideal means those in whom catheter ablation is most effective, are the younger people who are having frequent and symptomatic atrial fibrillation and who probably have failed at least one antiarrhythmic medication. However, if you look at the population at large, even those patients who have persistent or continuous atrial fibrillation will benefit from catheter ablation, but they need to be selected on an individual basis. If somebody thinks they have atrial fibrillation, they need to have this documented to be diagnosed. Some of these symptoms with atrial fibrillation are you feel as if you are having palpitations, you may be short of breath, you may be tired, you may be lethargy. However, many of these symptoms may be caused by other rhythm disturbances. So the diagnosis of atrial fibrillation need to be confirmed either by an EKG or by some kind of monitoring system. And there are several monitors in the market which can be used either for a 48-hour monitor or a 30-day event monitor. all this can be done at your primary care physician's office. And if primary care physician feels that you need to be referred, then they should refer to either cardiologist or electrophysiologist for further workup and management.
Our program offers the latest and innovative technology. We have 3 dedicated EP labs. We also have dedicated support staff and personnel that have been well trained to offer the services that we provide. These staff help us to carry out technologically advanced procedures that provide the most innovative treatment available today for treatment of these arrhythmias.